COVID-19 numbers are going in the wrong direction. Doctors are blaming it on a couple of factors, including the new variant. Thanks for joining us tonight for NBC4 at 11. I'm Colleen Marshall.
Hello to you. I'm Kerry Charles. Franklin County and some other central Ohio counties are back to the medium level on the CDC's COVID map.
NBC4's Eric Halperin has been talking with doctors about all of this and the changes. And Eric, it's been a while since our county was in the yellow.
Colleen and Carrie, the commissioner of Franklin County Public Health, says it's been at least a few months. Now, to determine that level, the CDC looks at a few different factors, including the amount of COVID-19 in the community and the number of COVID-19 hospitalizations. Franklin County back in the yellow medium level on the Centers for Disease Control's COVID-19 map.
I mean, it's concerning, obviously, but I think we just have to watch and see what happens.
Christopher Gonzalez is well aware of the fact we're still dealing with the pandemic. He says family members have COVID-19 now. Frustrated this is still going on after about 2.5 years.
At this point, I'm used to it, but I mean, for the most part, I think at some point it's going to get back to some kind of normalcy.
Ohio Health infectious disease expert Dr. Joseph Castaldo says cases are on the rise and parts of central Ohio are medium for a couple of reasons.
We are now dealing with a new variant that is more immune evasive from infection, BA.5. It's very transmissible. Also, too, we all have COVID fatigue.
Hospitalizations are also increasing. Data from the Ohio Hospital Association shows almost 1,200 COVID-19 patients statewide as of Tuesday. Numbers in January were above 6,500.
There is a lot more COVID in the community. Hospitalizations in the state of Ohio and here at Ohio Health are up a little bit, but they're nowhere near as high as what they were during their last winter surge.
Franklin County is not alone at medium. Delaware, Madison, and Pickaway counties are also yellow. Franklin County Health Commissioner Joe Mazzola writing, "The CDC moving Franklin County and several neighboring counties to yellow is obviously of significant concern to us. It's a reminder we need to continue to take precautions."
If you have an at-risk condition, if you are immunocompromised, you should talk to your healthcare provider about wearing a high-quality mask. As an infectious disease doctor, my at-risk patients, I am advising them to wear a high-quality mask indoors in public.
And Dr. Castaldo also says case numbers are likely higher than what's being reported due to a lot of at-home testing taking place. Local for you in Columbus, I'm Eric Halperin, NBC4.
And Eric, leaders estimate long COVID has affected millions of Americans, causing serious long-term health issues that have ended with many out of the workforce. Today, long COVID patients, many of them spoke before Congress, and many of them say they are disabled, chronically ill, and undertreated now years after they became infected. One doctor who has treated hundreds of patients in similar situations is asking lawmakers for better research, treatment, and access to disability benefits and workplace protections for patients.
There's not a way for me as a physician to diagnose long COVID based off physical exam, blood work, an EKG, or a scan.
Lawmakers estimate that at least 4 million Americans are not working because of long COVID. The Brookings Institution says that by 2030, that could result in $500 billion in lost wages annually.
CDC Director Dr. Rochelle Walensky today signed off on the recommendation of a CDC advisory panel adopting the 2-dose COVID vaccine made by Novavax. Just last week, it was authorized for emergency use by the FDA and then recommended by the advisory panel. Dr. Walensky's approval means more than 3 million doses of Novavax are now ready to be injected into arms. The 2-dose vaccine already authorized in more than 40 other countries and the European Union.